Hi everyone, for my evidence-based practice research assignment, I chose the topic of healthcare access. More specifically, I focus on community-based healthcare navigation as an evidence-based practice that helps improve access to medical care for the underserved population. This topic connects closely to my service placement at the moment because a big part of the work that we do involves helping clients connect to health related services and understand available resources, and as well as work through barriers that make it harder for them to get care. A lot of our clients face issues like not having insurance, transportation, problems with like cost, language, or just not knowing how to navigate the healthcare system, which at times could be complicated. Because of that, healthcare navigation is very relevant to the kind of work being done at my agency. For my main article, I chose the study by Soluya. Her article title is Community Based Healthcare Navigations Impact on Access to Primary Care for Low Income Latinos. I chose this article because it focuses specifically on medical access, especially primary care, and it connects very well with the kind of support and social that social workers and community-based programs often provide. The article looked at whether the community-based healthcare navigation improved access to the primary care for low-income Latino participants. The researchers compared people who received navigation support with people who did not. So the navigation support helped participants understand the healthcare systems, connect with services, and deal with barriers that were getting in the way of their care. The study found that people who received navigation support were more likely to have primary care clients and primary care providers. They were also less likely to report barriers like not having insurance, not being able to afford care, and not having transportation. Overall, the articles showed that navigation services can make a real difference in improving access to like medical care, especially for those like facing multiple barriers like the ones I mentioned previously. Um, I did read a few other articles in addition to the main article that I was reviewing. One article focused on community health workers acting as healthcare navigationers and in a primary care and chronic disease management. Another looked at system navigation programs that connect primary care with like community-based health and social services. And I also reviewed an article about how community healthcare workers are effective in both healthcare and public health settings. um, the last one that I looked at is it in oh my God, last I included like an article um, that talked more on like behavioral health care and how they deliver through street medicine programs in California specifically. Even though each article looked at like different settings of or populations, they all pointed at the same general idea, which is that people are more likely to access care when they have support in navigating systems and and those systems help them connect to services that they might need. There were many strengths in my research that I reviewed. Um, all of the articles were recent, so all were within like the 5 years. Uh, the research was focused on understanding populations, which is important because those are often the same communities served in social work and community-based settings. There were also some limitations, though. One limitation is that the studies use different types of navigation programs, different settings, and different populations, so it can be hard to apply the findings in exactly like the same way across the board. Another limitation is that some studies focus more on like short-term outcomes, whether some got connected to a provider or attended care instead of like long-term health outcomes. But I do believe like even though with these limitations, the findings were pretty consistent in showing how navigation and support services improve access to care. And just again, to bring it back to my placement, these findings support my current practice at my placement because the work being done is not just about giving clients information, it is also about helping them actually connect to services, following through, and reducing those barriers that they are facing at my placement. That could include like helping clients with like medical services, connect them with insurance or benefits, referrals, and access community resources that affect their health. The research support that this kind of work is not only helpful but also evidence-based. But just overall, this research helped me better understand that improving healthcare access takes more than just simply telling someone where to go. A lot of clients need support and a lot of follow ups, and especially advocacy and helping them navigate the system that could be confusing and overwhelming for some. Community based health navigation is an evidence based practice that fits well within social work values because it promotes service, dignity, and access and equity. Um, yeah, thank you.